It's time for our monthly visit from UW veterinarian Sandi Sawchuck and her buddy Dozer.
Hi, Sandy. We're taking your calls, by the way, at 270-9933 if you'd like to call and talk to Sandy.
Turn this way.
Yeah. Oh, he is so cute. How old is he now?
He's 10 and a half. Wow. And I just found out last week that his dad died because he bit through an electrical cord as a 10 and a half-year-old dog and electrocuted himself.
Oh, no.
But Mom lived to be 14, so I'm hoping to have him for a long time. And actually, the reason why he's with me today is he has to go in and have some dental work done. He has a small, probably benign mass in his mouth that we're going to have taken care of and get his teeth polished. And it's just a good example that age is not a disease. Blood work is pristine. Mm-hmm. He's a healthy, happy boy, even though he's 10 and a half, and going to use up my summer vacation money to...
And it's a reminder that dogs' teeth need to be cleaned.
Oh, definitely. It's a source of infection for the entire body, and I want him to keep living for a long time.
All right.
So, yeah.
Let's go to the phones. We will start with Christine in Verona. Hi, Christine. What's your question? Are you there? Christine?
Christine, can you hear us?
Old male cat was diagnosed with parasites, and we had him treated at the veterinary. And I was wondering if there's anything we can do to not get the parasites to come back.
Can you tell me what kind of parasites they were? Do you know?
I'm not sure.
Okay,
well, we're talking about a 3-year-old cat here.
Yeah, there's a lot of different parasites that cats and dogs can get. And we kind of break them down into 2 categories. Internal parasites, which would be things like heartworm disease that lives in the heart and the lungs, or intestinal parasites that are there usually from exposure to soil, eating prey like bunnies and mice and so on. We also see external parasites, fleas, ticks, lice, mites, and so all of them are treated differently. And when you have a pet that has a parasite or been diagnosed with them, it's important for you to be able to know what they are and how to treat them appropriately, because you're going to be involved with the care at home. There's a wonderful website to go to that is called CAPC, stands for Companion Animal Parasite Council. It's capcvet.org. And they have an amazing site for owners on there, so you can go and look up things. And it's great. Even the veterinary site is wonderful. And what I use it for is when people say, well, what's the incidence of heartworm disease where I live? They have that all broken down across the country for every parasite that pets can get.
So CAP.
CAPC, okay.
CAPC.
Okay.
Not CCAP, that's the bird thing.
Yeah, capcvet.org.
Capcvet.org.
All right.
Okay, Joyce in Baraboo. Hi there. What's your question?
Good afternoon.
Hi.
I have 2 cats, and they both have been sneezing quite a bit. And it started before summer, and it continues now where it's really... I don't know what to do for them anymore.
Yeah, I mean, cats can sneeze for a number of reasons. The fact that it's 2 makes me think that it may be something contagious. The number one things that we see are the things that we vaccinate for. Primarily rhinotracheitis, which is cat herpes, can cause recurrent nasal and ocular problems, eye problems. And just like us with cold sores and so on, you get a little stressed and they end up coming out with some symptoms again. One of the things, if that is the problem, that you can do that helps decrease the symptoms is getting them going on a supplement that's called lysine. Lysine is an amino acid that is available over the counter for people, but they also make it in a number of different formulations for cats, in a treat form, a gel, a powder, and so on. And what that does is it helps stop virus replication. So if that's what's causing the problem, it's a simple food supplement that's very safe that will hopefully get them over this a lot quicker. It's also possible, if they're related, it could be allergies. Yeah. Something you can...
Yeah, I'm dealing with allergies
right now with your dog. So yeah, and allergic rhinitis is something that we'll see this time of the year as well, when things are pollinating. And
All right, let's go to Dottie in Oregon. Hi, Dottie.
Hi.
Hi, what's your question?
I have a new 10-week-old puppy, and I'd just like to know the symptoms of kennel cough.
Yeah, kennel cough is one of those things that can be caused by a number of different organisms, not only Bordetella bronchoseptica, which is what is similar to our whooping cough bug that humans get, but also some viruses and other bacteria as well. And so the symptoms typically are going to be coughing. That's why it's called kennel cough. Usually it's a dry, hacking cough, and so if you pull on the dog's leash and you put a little pressure on their windpipe, that may be what causes them to cough. Usually they're coughing at night, keeping you awake, but they're typically feeling pretty good. Puppies, though, on the other hand, can get secondary pneumonia with this. And so if they're coughing and depressed and running a fever and not exercising as much, definitely something that needs to get checked out. Regardless, I think any coughing dog needs to get checked out. Just don't bring them into the vet clinic. Let them stay outside in the air-conditioned car because this is contagious, and then they'll probably usher you right into the exam room. So sitting in the waiting room with a coughing dog just spreads it to everybody.
Absolutely. Let's go to Jean in Blue Mountains. Jean, you there?
Yes. I have a question. I have an 11-year-old male Pomeranian. His teeth have been cleaned. He has no cracked teeth. He had a couple removed, but he has just horrendous breath.
Yeah.
And I was wondering if there was anything you can suggest, because
Yeah.
I'd be willing to do about anything.
Yeah, my guess is that he probably still has some periodontal disease. I'm not sure if your veterinarian took x-rays when they cleaned the teeth to see if there's any deep pockets or anything there, but that is usually where that odor is coming from, is from around the gum line, and you've probably still got residual disease. What I would be recommending, just like I am taking my dog to a specialist tomorrow, see about having your dog evaluated by a board-certified veterinary dentist that can do all of that. There are other vets in town that do it as well, but they should be getting x-rays and really treating each tooth like it's an individual so that they can treat the disease at the spot where it is.
And how often should a dog's teeth be cleaned?
Well, I mean, a daily.
it's
it's
anesthesia.
an anesthesia, at least annually, okay, especially as they get older. And remember, age isn't a disease, but home care is ultimately the thing that they need to do. Once that mouth is cleaned up, getting in there and brushing and doing some other things with dental treats and so on.
All right. We're out of time.
Oh,
Thanks for calling in, everyone.
Yeah, thank you for your calls, everybody. The time goes by so fast.
remember,
Thank you for bringing
and
Dozer
I think we
today.
bored him, yeah.
And remember, with the extreme heat coming, make sure that lots
yeah.
of water and the cool place.
Especially push-nosed dogs like this need to be in air conditioning.
Absolutely. All right, Sandy, thank you.
All right,
Nice to
thanks.
see you
Good
again.
to see you.